Hello and welcome to this webinar from the University of Southampton. Wherever you are in the world, you join us on a spring morning in Southampton. I am Jan Podobinsky, the Director of Internationalization for our School of Economics, Social and Political Sciences. In your invitation to this webinar, you'll have had an opportunity, I hope, to link to a very brief presentation by our head of school, Professor Nikos Savidis, welcoming you and outlining the school. Today's webinar is going to focus on two master's programs, the MSc in Global Health and the MSc in Applied Statistics, both of which are part of the suite of master's programs from one of the departments in the school, the Department of Social Statistics and Demography. This is a world-renowned department for excellence in its research, in its teaching, and its public engagement. Today's webinar will be structured in four parts. The first part will be a taster lecture presentation, drawing upon both the Global Health and Applied Statistics components of the master's programs. The second part will be a program outline and presentation on the MSc in Global Health, including job opportunities. The third part of the structure will be focusing on the MSc in Applied Statistics and its program structure. And finally, the fourth part will be an opportunity for you to ask questions that we will attempt to answer. And please post your questions through either question or chat in the webinar software. So first of all, I'd like to welcome to present the first two parts of the four parts. I'd like to introduce a professor of demography and global health, Professor Sabu Padmadis, who will present the first two parts of the presentation.
Hello, everyone. Greetings and a very warm welcome to the University of Southampton. So I'm Sabu Padmadis. I think Professor Jan Podobinsky has already mentioned who I am. So I'm really going to get in straight into the kind of to the topic of today. But at Southampton, what we do is actually a research-informed teaching. What does that mean? It means that what we teach, so we teach what we do research. So what we research. So that's actually been the Southampton's sort of focus ever since its existence. But as you know, that as we travel towards some of the most extraordinary times in modern history, like many of the universities, institutions across the world, we are also committed to changing the world for better. So researchers in Southampton and Oxford have now started vaccine trials for coronavirus. So we hope that probably in the next, next few years, or sorry, next few months, if not within a year, we will be able to really find a solution. Well, before I sort of start, if you have any questions, then please do ask us via chat function. Do not hesitate. I mean, because it's an open forum. Please do feel free to interact with us. You will have also opportunities later in our QA sessions later on. So on the topic is beyond the COVID-19 pandemic. Why that topic is because infectious diseases, as we know, have always been present since our human existence. So ever since we existed, I think infectious diseases have been present. These are predominantly pathogenic microorganisms such as bacteria, viruses, parasites, or fungi, and we have seen that kind of massive changes. We have seen that these infectious diseases have been there for a long time, from smallpox to the bubonic plague in the 14th century, which killed literally about 75 to 200 million people, literally half the population at that time. And then the Spanish flu pandemic, then the Ebola virus that we have seen recently, malaria, cholera, AIDS, HIV. HIV was not really a pandemic, but it was really because it was not really airborne, or it was not that kind of infectious disease, but it was a significant epidemic that we have ever seen in the last century. But I mean, since 2000, perhaps we have seen a large number of new types of infections. And for example, SARS, in 2003, swine flu in 2009, MERS, which is a Middle East respiratory syndrome in 2012, around that time. And then, of course, Ebola was actually, it re-emerged recently. And now SARS-2, which is the coronavirus. And the most tricky ones are the ones which tend to mutate and evolve over time. So, it tends to really, there's some kind of mutation that happens with viruses particularly, and especially the zoonotic diseases of animal origin, which can actually transmit to human beings directly or indirectly through an intermediate host. As we speak today, coronavirus has infected more than 3 million cases. I think so 3 million positive cases. That's phenomenal that you can actually ever think of. And we have over 200,000 deaths. So you see that we are all operating from online, sitting in a different locations. So these are always challenges, but we are overcoming these challenges. So what were we looking for? I think this is actually an important question for the last couple of weeks, if not almost daily. So we all know that it was facts, information, data. So what we were looking for is actually scientific data, clinical data, social statistics data, economic data. So why do we need those? For making urgent public health interventions, for designing and even implementing those interventions. And the data, we also need proper data for actually statistical, epidemiological, and mathematical modeling. So here we have actually a question from Roni Omolo from Kenya. So that was really very interesting question, Roni. You asked a very interesting question about the parameters. What kind of parameters we need to really consider? Let me see. Yes, what kind of parameters you need to consider before you undertake a modeling of pandemic? And you also say that the projection could be inaccurate. Well, it wasn't inaccurate, as you say, but that's universal. Nobody now has a clear idea of what the virus is, because it's not just with the Kenyan government. Because the coronavirus is a novel virus. We have no idea about its genomic structure. I mean, although every day we are probably understanding its structure better, but we don't know its mutation probabilities. And what we know, for instance, is that it is a highly contagious virus, and the rate of transmission could be significantly high, because it need not be confined to only older people, but it's actually everyone is at risk. So the mortality risks are also higher. What matters is actually the viral load. So why we are saying lockdown and social distancing, is actually that distancing is essential to reduce the viral dosage of the viral load during this transmission. So even in Kenya, you have got 14 deaths and probably about 300 cases confirmed. And Nigeria, which is the most populous country in Africa, has got about 40 deaths and roughly about a little more than 1,000 cases confirmed. And in fact, India was in that position a few weeks ago. So now, the positive confirmed cases are about 30,000, and there are about 1,000 deaths. So so we are actually living in a very uncertain world. We don't know the actual facts yet. So therefore, it's not that easy to really undertake any kind of exercise at this moment. So we can actually, of course, based on the data and information that's available every day, we can do statistical, mathematical, and epidemiological modeling to understand the evolution of the virus better. But what is today's million-dollar question? I think I would like to really refer you to the next slide quickly. Daisy, could you please move to the next slide? This is actually one of my own contribution. One of the arguments here is that nobody is safe until everyone is safe. So there is no point in saying that the UK, we have managed everything and extra. So the million-dollar question today is that, when can we confidently exit from lockdown? So when can we really release ourselves, come back to normalcy? Because the impact that this virus had already on economy and so on is phenomenal. It's a massive scale. We already know that another global recession is there already. So it is important to read that we get out of this lockdown as early as possible. But I think there are a lot of challenges, partly because of this uncertainty, and we need to really make sure. So the data that we have currently are not really widely, I think there are lots of estimation issues. There are ways in which the data, so there are certain sources through which these data are obtained, and those sources have been, I think, we have questioned those sources because sometimes reporting of mortality, deaths, or reporting new cases may not exist. So that's also in many parts of the world, and particularly in parts of the world where health systems are not really dysfunctional or partly functional. So there are lots of uncertainty. So what we need to do is that actually the only way that we can actually move forward is actually, as this correspondence in Lancet mentions, that it's universal weekly testing is actually what is important. So one of the challenges that we have is that we live in a very uncertain world, an interdependent world. So what I meant is that, well, it's, as I mentioned before, it's not just that we come out of the lockdown here in the UK or in another part of the world, but it has to be really globally. I mean, it has to be kind of managed globally. So because of these complexities, I think it's highly likely that that a virus, because this virus is also present now, it has probably affected more than a third of the world population, I mean, in terms of infection. So that means that probably the virus is present or endemic in our environment. So that means it could really mutate into new forms. It could actually come out and then into a new kind of evolved into a new strain, and then we might see another wave of infection probably along the line this year. So there are also, I think these are also important because we live in an ever larger kind of urbanized world where everything is driven by anthropogenic factors. As we know that the infection is actually passes from animals to human beings through an intermediate host. So here, what we know about it is that these are all related to human activities, anthropogenic factors. So, I mean, that's something that we cannot really control of, because I think that keeps evolving all the time. So, the human civilization actually close to wet farms, etc. So the other factors that are important is actually something that people have not really enough reflected on, is the population migration. So, for example, if you look at what the scale of migration happening in Africa, in Asia, and in Latin America, and perhaps not so much in Europe, but the other parts of the world, it's incredible, phenomenal, unprecedented migration taking place. Mobility and changing population structures. Population structures are changing. So here we have, in Europe, we are actually confronted with an aging population, an elderly population. Therefore, mortality risks are very high, I think, among those who contract these infections. The other aspect is about rapid economic growth and widening inequalities. So the income, so unfortunately, probably about, even about official statistics really show that more than 80% of world's income is actually held by 1% of the population. And that is not right. And that, that's not really going to resolve these crises. So because it's very important that we narrow, we narrow the kind of the gap between the rich and the poor. There are also global influences of trade, marketing, and advertising. So that's another one. Next slide, please. So on the other hand, there are also other challenges. For example, our dietary patterns have changed. These are beyond, I mean, we're talking about more towards chronic and non-communicable diseases. Chronic diseases like diabetes, hypertension, these have become very common these days. Even when let's say, when a woman goes to a health clinic for pregnancy services, they are actually diagnosed with these conditions these days. And on the top, we have also climate changes and environmental threats. Then, very importantly, I think war and conflict. I mean, in fact, we are at the moment in a war with an unknown enemy at the moment. So because, this coronavirus is actually very hard to really understand and conquer. So conflicts are actually yet another reasons, are definitely, we have seen more conflicts probably since 2000 than before. And finally, I'd like to really touch upon the role of information technology and information systems. I think that's quite important, because I think we have, I mean, despite having these wonderful technology, we are still struggling. I mean, that's something that we need to really reflect on. Why? I mean, despite we have all these kind of artificial intelligence, we have all sorts of data, but perhaps when another pandemic occurs, probably we are probably better prepared. That's what I think. So this is just to really give you a quick overview of the part that you see in blue are the burden of non-communicable or chronic diseases like heart diseases or heart attacks, strokes, cancers of different forms, lung cancers, back pains, etc. I mean, with older population, you would also expect lots of osteoporosis and similar bone-related problems and so on, back pains and falls, etc. Alongside, we also have what is known as a growing burden of mental health issues. So, for instance, depression, anxiety, and so on. Even during the COVID season, I think, or probably post-COVID, we will see probably a kind of high prevalence or high incidence of all these mental health problems. And then we have what we have in this kind of pink color is actually, they are the kind of communicable diseases. So in fact, I mean, although we don't have corona or other viruses here, but that's currently, if you look at this chart, I think probably we also have a substantial proportion of substantial share of that burden attributed to communicable diseases. So HIV, it's actually we can see that it is coming down, but still it is present in many parts of the world, even including in some parts of Eastern Europe. It has actually re-emerged. And then we have other forms of injuries, falls, road accidents, and so on. So I think this is the way ahead is going to be really challenging in terms of really these burden of communicable and non-communicable and chronic diseases. I love this quote. You see, this is from Vinod Khosla, an Indian-American businessman and a venture capitalist in the US. He made a very important point. In the next 10 years, data sciences and software will do more for medicine than all of biological sciences put together. Look at that. I mean, that is going to be the world that we are going to really see in the future, because it'll be a lot about understanding big data, understanding the dynamics of these data and synthesis of these data to really understand a health phenomenon better. So I think I'll stop there, and you may have some questions. So I'll take one or two questions before moving to the program, the global health program. So what is global health? So I'm here to really also in my capacity to really talk about the Masters in Global Health. So what is global health here is that actually it's global health is something which actually touches almost all sectors. So that's the best way to describe it. So global health is probably in local community these days. With globalized world, health starts local and to the global level. So, and what we know, for instance, is that, well, historically, I think the modern risks, if you look at it, I think like for example, we are talking about urban air quality, road traffic safety, and obesity, population obesity, etc. These were not really present historically, but these have really evolved over the last couple of years, or last 3-4 decades. We have really seen a high burden of those diseases. But although the traditional risks, like the infectious diseases, have come down, still we do have those challenges. For example, the coronavirus. We have also a huge challenge of dealing with undernutrition and across the world. I mean, that remains a significant challenge. Access to basic essentials of life like water, sanitation, and hygiene. We're also missing that. I think there are these challenges. So I mean, these are just a few examples of the range of issues, the challenges that cut across different sectors. So starting from road networks, poor road networks in sub-Saharan Africa, to high pollution, air pollution in Chinese and Indian cities, and large gap between the income gap between rich and the poor. I mean, that's also a big challenge. High dropout of girls from secondary schools in Pakistan, poor uptake of modern contraception in Nigeria. I mean, and so you name it. So these are all really different challenges that you see in today's world, which has got a very clear global health dimension. And also we have seen that, well, increasingly the conflicts, etc., I think are also quite, have emerged to be as one of the significant challenges when we talk about global health. Okay, so our MSc Global Health is very interdisciplinary. So it has got demography in it, social statistics in it, geography, for the same reason that I've mentioned. Well, all these are really represent different disciplines. So in fact, it has no boundaries. It really transcends across different disciplinary boundaries, and that is global health. And in addition to that, I think what is also important is to really think of global health as a tool for developing and implementing solutions which often require global cooperation, and that's also very important. And the focus is on health equity across the nations and people. There's a difference between inequalities or equality and equity. Equity is more towards the rights perspective. Health is actually a basic right to all citizens across the world, and so that is actually quite important. And it also embraces both population preventive approach and clinical care of individuals. And as I mentioned earlier, this is quite a highly interdisciplinary and multidisciplinary kind of area, and it extends beyond medicine and health sciences. So the program addresses critical issues, and it introduces a mix of practical tools, theoretical perspectives, and technical subject-specific knowledge. It has got a very interesting quantitative focus, because that's important. As we said, that well, we all live in this data world. We need to really understand these data. It's not just absorbing these data, but also the ability to really critically think and interpret and infer these data are very important. And as I mentioned before, I think we are all research informed. Everything, whatever we do is actually research informed, taught by research active staff. So in terms of the program structure, we have got the compulsory modules, which focuses on critical issues in global health, quantitative methods that will give you a taste of different statistical tools, statistical courses that you might really find it interesting. And these are all very important and compulsory for the program. Why? Because I think, because of the reasons that I mentioned before, and also we draw synergy from other programs, particularly in our department, for example, demography and statistics and so on. And epidemiology, definitely, obviously, methods and analysis of global health differentials, population and reproductive health, it's still a very important area, and dissertation. Optional choices, you have a wide range of choices. You could really take different modules in demography, geography. So if somebody, let's say if somebody who's really following this course is actually interested in specializing geographical information system, there you go. You have that opportunity. Someone who is really wants to specialize in gerontology, or the study of aging population, or social or clinical gerontology, I mean, there is actually an option. Public health and nutrition, and there is also an opportunity for those who are interested to really develop or strengthen their quantitative skills further. We have advanced quantitative research methods, and we also have qualitative research methods as provided as an option for this program. So these are a couple of quick examples of dissertation projects. Distribution of drug-related deaths in the United Kingdom, determinants of obesity in Ghana, Kuwait, and so on. Determinants of newborn deaths in Gambia, undernutrition in Nigeria, and so on. I think so. We have actually so there are these are really wide range of topics that one can actually undertake. Sometimes you can also do it with undertaking an internship with an agency, like for instance the WHO or UN and so on, or government departments. So I just want to really highlight that we also have some scholarships available, and the deadline is 15th of May 2020. So we have some scholarships offer, like welcome scholarships offer full tuition fee, but some actually cover, they are like bursaries. So if you have an excellent academic credential, then we want the bright minds to really work with us, to join us. So you will be given those opportunities. You'll also have opportunities to really sometimes contribute to small projects while you are here. So just to let you know that, well, our academics have partners and collaborations in many countries, low and middle income countries across the world, from India, China to Colombia, Oman, and so on. We have very strong links. We work very closely with government ministries. So for example, with the UK Government Statistics Department, we work with them very closely. We work also with different government Ministry of Health in various countries, and international agencies such as the WHO, UNICEF, UNDP, UNFPA, Department for International Development, Norwegian Development Aid, Australian Aid, and so on. So it's really wide ranging. So that's actually, that gives, for instance, students, I think, that opportunity to really experience, to gain some kind of, practical experience into understanding how you get into those kind of consultancies, how you get into those of designing different programs, etc. So if you have any information regarding this program, so we have Dr. Sarah Neal. She's the Associate Professor in Global Health. She's also the Director of MSc Global Health Program. She'll be very happy to really answer your questions. So if you have any questions related to Masters in Global Health, please do write to her. And I hope this actually, despite these technical challenges, which we can't really help, I hope this session actually gave you some ideas of the beyond COVID pandemic, because we should be thinking way into the future of the challenges. I hope that was useful. Thank you for your attention. Thank you.
Thank you, Sabu, for both a very topical and thought-provoking presentation, and also for that overview of the MSc in Global Health. We now move on to the third part of our webinar, which will focus on the MSc in Applied Statistics. And for this part of the presentation, I'd like to introduce Dr. Heini Väisänen, a lecturer in Social Statistics and Demography and the program lead for the MSc and Applied Statistics. Over to you, Heini.
I would like to say thank you everyone for coming. And I'm the program director for MSc Applied Statistics. And I'm here to tell you a little bit about the program and what you will be learning in that program. Okay, so we'll start with an overview of MSc Applied Statistics. So this MSc program provides you instruction in the theory and methods of applied statistics. The compulsory modules include topics such as statistical theory and linear models, generalized linear models, statistical computing, sampling techniques, research communication skills, and complex survey data analysis. And all of these modules will give you an overview of theory and application of statistical methods in a variety of settings. These methods can be used to design, collect, and analyze large-scale data. And since this is a program that sits within the Faculty of Social Sciences, there is a specific emphasis on survey research in the social sciences, even though the methods that you learn can be also applied more widely. You can take option modules in many different disciplines, such as demography, data science, and mathematics. This course takes 12 months if you take it full-time, or 27 months part-time, and it's located at the Highfield campus of the University of Southampton. So why should you, if you're interested in studying statistics, why should you come to University of Southampton? Well, one of the best reasons, in my view, to come is that this is actually a university that provides one of the best instruction in this topic of the world. So according to the QS World Rankings by Subject 2020, our statistics and operational research is the 37th in the world across all universities in the world. In addition to that, I think this is a very interesting place to study applied statistics because the Department of Social Statistics and Demography that this program sits in is very interdisciplinary. So we have people from, in addition to the statisticians, we have people who have specialized in global health, demography, data science, and kind of social sciences in more general terms. And that means that whatever your interest is in terms of applying your statistical methodological knowledge, we can find people to help you dive into that topic. The teaching in this program is provided jointly with the Department of Mathematics, so you will also get the more mathematical side of things. And like I said earlier, you will have a possibility to take optional modules from other social science programs within the School of Economic, Social and Political Sciences, which could mean something like sociology, social policy, gerontology, or criminology, and many others. We also have two research and training centers that are partially or fully in our department. The S3RI is the Southampton Statistical Sciences Institute, and NCRM is the ESRC Centre for Research Methods. And these both provide training not only at the University of Southampton, but also more widely in the UK, and provide very strong subject expertise on these topics. If we look at our employability statistics, they look very excellent. So the vast majority of people who have graduated from our MSc program within 6 months of graduation are either in further studies or maybe doing a PhD or working in a full-time job. So when it comes to the type of delivery and the facilities that we provide, these are all very high quality and provide you whatever you need in order to be successful in your program. So in terms of learning, we will have lectures, which are kind of for a big group of people and more centered around lecture, talking to you like I'm talking to you now. Or it could be seminars, which are smaller groups, more conversational, and give you a chance to actually ask questions. You will have computer workshops where you will actually put your new skills into practice. And then you will both work individually and in groups. At the end of the third part of the program, you will write an MSc dissertation, which is something that you work on independently. It's a research project that you conduct over the summer. And you will have a supervisor from our department who will be a leading expert in the field of applied statistics who you can work with and who will help you through this process. And you will have access to the latest statistical and other software that you might need and other facilities at the university. So since you're offer holders, I won't spend too much time talking about the entry requirements, but I thought this might be an interesting slide in case you're wondering who else might be studying in this program. So we normally have people who have had their first degree. It could be in statistics, mathematics, econometrics, engineering, and many other social and natural sciences that include a significant component with statistics training. And usually people that come for this program are passionate about a career, for instance, in statistical research, could be market research, data analytics more generally, or government. So a lot of our graduates have gone on to work for different government departments, including statistical offices, but also other departments that need people who have strong skills in statistical methods and data analytics. So I thought it might be interesting to hear what other students who have already studied in this program have said about the program. So they said, for instance, that the university offers great support for its vast community of international students, and this includes social and language support. So we have a strong track record of having a very international student body, especially in this program. So no need to worry if you're not a native English speaker, if you haven't lived in the UK before. Another testimonial says that I was attracted to University of Southampton because of this highly rated research status. So especially if you're interested in doing work that has to do with research and statistical research, more specifically in the future, like I said, this is one of the best universities in the world to be studying this topic. And then finally, the quality of the lessons and level of teaching are both very high. So consistently, when we ask students to provide us feedback in terms of what they think about teaching and the program and everything else, they are very happy and very content with the quality that we deliver in Southampton.